Chapter 20, Part 2. We continue blood vessels and circulation, and here is your table of contents. Let's talk about capillary exchange of respiratory gases and nutrients. What happens between those tiny blood capillaries that we have in all the tissues and surrounding them tissue cells? They would be everywhere, those tissue cells. First of all, diffusion. Oxygen and nutrients go from the blood to the tissues. Carbon dioxide and all the metabolic wastes produced by the cells will be moving from the cells back to the blood. Lipid-soluble molecules usually can diffuse easily through the endothelial membranes. So those are endothelial cells, and through their membranes, lipid-soluble molecules can go from the blood to the cells and from the cells to their blood. What about water-soluble molecules? Solutes. They have to go through the cleft between the cells, or they have to go through their fenestrations. If molecules are really large, like protein molecules, they will be transported in vesicles. Pinocytosis, that's, remember, transportation of water. Pinocytosis and endocytosis, exocytosis would be transportation of large molecules. What is bulk flow? It's movement of fluids in large amounts from the tissues to their blood, capillary bed, and from the capillary bed back. So that is from capillary bed to the tissues, into the tissues, and that is from the tissues back to the capillary bed. That would be wastes and carbon dioxide, and right here cells will receive oxygen and nutrients, and also hormones for regulation. So direction and amount of fluid flow depends on two forces: hydrostatic and colloid osmotic pressures. You need to be able to explain both of those. Hydrostatic pressure. Remember blood pressure that is created by blood pumping from the heart through aorta. Blood pressure in aorta would be 120 millimeters of mercury normally. It will be lower into their mid-sized arteries, and when it comes to the arterial end, to the capillaries, right here it would be 35 millimeters of mercury. So it tends to force fluids through the capillary walls outside of the capillaries into the tissues, because it's higher than pressure in the tissues. At the venule end right here, that capillary hydrostatic pressure will be much lower. Please remember that number 2. Right here it will be just 17 millimeters of mercury. Now let's talk about second force, colloid osmotic pressure. Remember osmosis. Here's concentration of water is lower, and concentration of large molecules is higher. At the other part of the cup, across the semi-permeable membrane, the concentration of water is higher. So where water will be moving from high concentration of water to low concentration of water. That is what is called osmosis. Now let's talk about our capillary beds and surrounding them tissues. Concentration of proteins, large molecules, will be higher inside of the blood vessels, inside of the capillaries, much higher than in surrounding tissues, in those spaces between the cells where some amount of fluid is located, interstitial fluid. That's why water by osmosis will be moved from the tissues into the capillaries. and it will happen mostly at this end, the venous end of the capillary bed. The pressure capillary osmotic pressure on average is 26 millimeters of mercury. Okay, let's summarize. All the forces acting on a capillary bed together are called net filtration pressure. And net filtration pressure will be different for the arterial end of the bed and for the venous end. At the arterial end, hydrostatic forces dominate. Hydrostatic pressure, or your blood pressure, trying to push water out of the capillaries will be 35 millimeters of mercury, while protein pressure, colloid osmotic pressure created by proteins, will be just 25 millimeters of mercury. So the difference, net filtration pressure at the arterial end, will be 10 millimeters of mercury, and water is going out. At the venous end, your hydrostatic pressure becomes low, just 18 millimeters of mercury. But colloid osmotic pressure is still high, 25, 26 right here at this end. That's why the difference will be -7, and because of proteins and osmosis, water will be moving into the capillaries. So that is your net filtration pressure. Please remember the numbers for both ends of the capillary bed. Now, since overall hydrostatic pressure is higher than osmotic pressure, more fluid will going out of the capillary through the filtration that enters through reabsorption on the venous end of the capillary bed. So that excess fluid is picked up by lymphatic capillaries and finally will be returned into the blood through the subclavian veins in the neck. Why is it necessary to leave part of the fluid in the tissues? Because when it's going through the lymphatic system, it will be cleaned, going through the lymphatic nodes. Those will clean that fluid from bacteria, viruses, cell debris, and also from cancer cells. Before you continue, please answer the questions for part 2.1. Now let's talk how all of those blood vessels and their actions are regulated. That is homeostatic regulation of the vascular system. And an adequate blood flow to the tissues is regulated by 3 homeostatic mechanisms. Neural, it means the signals are sent from the brain and or spinal cord. Endocrine regulation happens through different types of hormones produced by endocrine glands. And finally, there is autoregulatory mechanism or autoregulation that happens right there in the tissues. Let's start from the neural regulation. We have 2 cardiovascular centers that are located in the medulla oblongata. First of all, the cardio-accelerator centers. What do? They stimulate the function of the heart, causing it to beat faster by regulating not only heart rate, but also stroke volume. So the heart not only beats faster, but also each contraction of the heart is stronger, and the volume of blood that is pumped during each heart contraction, is larger. And that stimulation is provided through the sympathetic nerves. It's called cardio-accelerator nerve, and it originates from the spinal cord. Next one, cardio-inhibitor centers. Those slow down cardiac function. They decrease heart rate and they decrease the stroke volume. It means that the heart beats slower and every time it pumps less blood. That is provided through the parasympathetic stimulation through the nervus vagus or vagus nerve, which is one of our cranial nerve. Remember the number? The vasomotor centers, located also in the medulla, they control vessel tone of contraction of the smooth muscles in the tunica media. It means in the tunica media of the blood vessels, in the very central layer of blood vessels, which is made of smooth muscles, their tone can be changed. The vasomotor centers can either contract smooth muscles, and then the diameter of the blood vessel will become smaller, blood pressure will increase, or blood vessels can be relaxed, the diameter will dilate, and blood pressure will decrease. Continuing neural regulation. Baroreceptor reflexes. Baroreceptors are special receptors that feel stretch of the blood vessel walls, and they are located in aorta and carotid arteries. When blood pressure goes too high, baroreceptors feel it, they fire strong and activate parasympathetic stimulation of the heart. Heart rate goes down, cardiac output falls, and peripheral arterioles dilate. It means that blood pressure falls. When blood pressure drops too low, when can it happen? For example, some people in the morning, when they just woke up and they jump off the bed very fast, sometimes they feel it's darkening in their eyes because the blood pressure is too low. And in this case, baroreceptors can feel low blood pressure and they slow firing. That causes increase in sympathetic stimulation of the heart, and cardiac output increases, and peripheral vessels constrict, blood pressure rises. In addition to the baroreceptors, there are also chemoreceptors that monitor levels of oxygen, carbon dioxide, pH, and they can stimulate those cardiovascular centers in medulla, which will change blood pressure also. Now let's talk about endocrine regulation. Two hormones released by adrenal medulla during stress, fight or flight response, which is sympathetic, increase heart rate and also force of contraction. Also, they constrict temporarily blood vessels to organs that are not essential for fight or flight response. When you are fighting or running away from the danger, you don't really need your stomach to digest your food right now. So, most of the blood flow will be redirected to the liver, which provides us with glucose. It starts releasing glucose, delivering to the cells for energy. Heart starts pumping faster, increasing blood pressure to carry oxygen from the lungs to the muscles, and skeletal muscles for that fight or flight response. Those are organs that should be activated, and those are organs that received most of the blood during fight or flight response. So that mechanism is provided by epinephrine and norepinephrine. Antidiuretic hormone would be the second one. It is released by posterior pituitary, not produced there, just secreted. It's produced in hypothalamus. Please remember that. And antidiuretic hormones makes kidneys to reabsorb more water. So less urine is produced, the body doesn't lose a lot of fluid, and it helps to restore blood volume and increases blood pressure. So it happens very often in response to significant loss of blood volume. It can be due to the bleeding, or it can be just due to the dehydration when you don't drink enough of fluid. In addition, antidiuretic hormone constricts peripheral vessels, also increasing blood pressure. Renin-angiotensin-aldosterone mechanism. Renin is a hormone produced by the kidneys in response to decreased blood flow, low blood pressure. Liver produces angiotensinogen, that is a protein, and under the influence of renin, it's converted into its active form, angiotensin 1. Both of them are proteins. Soon after that, angiotensin 1, again, it's happening in the blood, will be converted into angiotensin 2 under the influence of special enzymes ACE produced mostly in the lungs. And angiotensin 2 is a very powerful vasoconstrictor. So it causes constriction of blood vessels, increasing blood pressure. Also, angiotensin 2 stimulates production of antidiuretic hormone, aldosterone from adrenal cortex, and increases blood volume and raises blood pressure. Also, it stimulates thirst. The person starts drinking more, which also increases blood volume. Finally, let's talk about AN8, atrial natriuretic hormone. It is produced by the cells of the atria of the heart. When blood pressure is very high, it causes extreme stretching of their heart walls, so stretching of cardiac cells, and in response, they produce AN8. And it promotes loss of sodium and water from the kidneys, which means production of urine increases and blood pressure drops. Also, it suppresses production of all the hormones increasing blood pressure, renin, aldosterone, and antidiuretic hormone production. Autoregulation of perfusion. So, perfusion is delivering of blood to tissues. The higher is perfusion, the better tissues are provided with blood and oxygen and nutrients. Autoregulation is automatic. It's adjustment of local blood flow to each tissue inside of that tissue in proportion to its requirement at any given point in time. What does it mean? When muscle is working, then it needs more blood. So it will receive more blood, even if other muscles of the body that are not working at that time will not increase their perfusion. There are two types of autoregulation: metabolic or chemical, and myogenic. Okay, metabolic regulation. Chemical signals. Vasodilation, or increasing in diameter of arterioles, and relaxation of precapillary sphincters, so blood could go to capillaries, happens in response to either declining tissue oxygen level. Cells are starving without oxygen, they demand more, sphincters relax, blood go to the tissues. Or in answer to substances from metabolically active tissues. Those would be ions like hydrogen and potassium, and also inflammatory chemicals. When there is inflammation going on in the tissues, they require a lot of blood to bring them white blood cells to kill bacteria causing inflammation. So effects. Smooth muscles relax right here, and blood goes to the tissues. Vascular endothelial cells, or cells lining blood vessels, produce NO, nitric oxide, which is also major factor causing vasodilation. Here's vasodilation: increase in blood vessel diameter. Decrease would be vasoconstriction. So, myogenic response. When blood flow is low, the vessel smooth muscles right here will be only minimally stretched. In response, they will relax, allowing the blood vessel to dilate, and it increases the movement of blood into the tissue. When blood flow is too high and those muscles are overstretched, they will contract and they will prompt vasoconstriction that reduces the blood flow to the area. If somebody exercises on a regular basis, it's very good for cardiovascular health. How? First of all, athlete's heart is larger than non-athletes. That's why when it contracts, stroke volume increases. The heart pumps more blood in one stroke. It means the heart rate goes lower, which preserves the heart from the stress and from overworking. Second, exercises lower overall cholesterol level and decreases the rate of cholesterol plaque formation inside of the blood vessels. Hemorrhage. When you're working in the garden and scratch your skin, or when you are cooking and cut your finger, usually it's a minor blood loss and it will repair itself. It will be managed by hemostasis. But hemorrhage is a loss of blood that cannot be controlled by hemostatic mechanisms. Usually it happens when larger blood vessels are severed. So in response to blood loss, heart rate increases up to 180 to 200 beats per minute to restore cardiac output. Also, to increase blood pressure, two things happens: vasoconstriction of the arterioles and constriction of the veins. And it usually works if blood loss is less than 20% of total blood volume. Together, these responses return blood pressure to normal and redirect the remaining blood to the tissues. While blood loss is more than 20% from the total volume of blood, it is very dangerous and it may lead to the circulatory shock, and it's a life-threatening condition. When your circulatory system cannot maintain blood flow, deliver enough of blood to the tissues, especially brain, will suffer in the first turn. So, blood vessels are not adequately filled and blood cannot circulate normally. Circulatory shock should not be confused with emotional or psychological shock. People in state of psychological shock typically will have not only increased heart rate but also very high blood pressure. People in the circulatory shock will have high heart rate but their blood pressure will be low. There are several forms of shock depending on what causes them. If it's caused by blood loss, severe blood loss, it will be called hypovolemic shock. And in children, it even can be caused by vomiting or repeating diarrhea. So diarrhea in little children is very dangerous and they should be rehydrated as soon as possible. Vascular shock is a result from extreme vasodilation and decreased peripheral resistance. What can cause it? Sepsis and also, common reason, anaphylactic shock. Anaphylactic shock is allergic reaction when a huge amount of histamine is produced, and histamine causes dilation of blood vessels all over the body. So that causes drop in blood pressure and vascular shock. Cardiogenic shock results when insufficient heart cannot sustain adequate circulation. Usually it's a heart problem like heart attack, heart arrhythmias, disorders of the valves, or other heart conditions. Obstructive shock happens when a big portion of the vascular system is blocked. For example, pulmonary embolism, when a blood clot sets in the blood vessels inside of the lungs and interrupts the blood flow. Now please stop this video, watch the animation shock, the link is under the video, and answer questions for part 2.2. Blood flow through body tissues. It's called tissue perfusion, as you already know, and you know that blood delivers oxygen and nutrients to the tissues, removes waste from them, and gas exchange happens in the lungs, where blood receives oxygen and gets rid of carbon dioxide. Also, tissue perfusion provides absorption of nutrients inside of our digestive tract, mostly small intestine, and urine formation also is provided by tissue perfusion. Blood goes to the kidneys and urine is made out of that blood plasma, mostly inside of the kidneys. So practically every cell, tissue, organ, and organ system in the body is impacted by the circulatory system. See more details in picture 20.22. You also know that there are two main circulatory pathways: pulmonary circulation and systemic circulation. Let's remember what they are about. Pulmonary circulation starts from the right ventricle when it pumps blood into the pulmonary trunk, which branches into the right and left pulmonary arteries, here they are, which carry blood, deoxygenated blood, into the pulmonary capillaries. In those capillaries, gas exchange happens, blood receives oxygen, carbon dioxide goes into the alveoli, and we just breathe it out, and oxygenated blood returns to the lungs through their right and left pulmonary veins into their left atrium. That's pulmonary circulation. Now systemic circulation. From left atrium, blood goes to the left ventricle, and left ventricle pumps it into aorta. And aorta, that's where systemic arteries start. Aorta gives a lot of branches. Those branches branch even more and deliver blood to all organs and tissues throughout the body. After gas exchange and nutrients and waste exchange happens in all the body tissues, blood is returned, deoxygenated blood, right now back to the heart by the veins. A few more differences that you need to know about arteries and veins. Arteries. Heart pumps the blood into single systemic artery, the aorta. Veins, blood returns via superior vena cava, inferior vena cava, and coronary sinus collect the blood from their heart tiny blood vessels, providing the heart muscle itself, coronary circulation. Most of the arteries located deep in the tissues, and veins can be either deep or superficial. Arteries do not interconnect to each other, and veins have a lot of interconnections. Arteries have a predictable blood supply, but what about veins? There are exceptions, like dural sinuses in the brain and hepatic portal circulation in our liver. Please answer the questions for part 2.3. Now let's talk about blood vessels themselves, their location and their function. So the main blood vessels would be originating from the heart aorta and its branches. It's the largest artery of the body, and it starts from the left ventricle. That would be ascending aorta, going up. the aortic arch that gives 3 branches, and then it goes down, and now it's called descending aorta. Arteries originating from the aorta distribute blood to all tissues of the body. Those 3 branches of aortic arch would be brachiocephalic artery on the right, which gives 2 branches, right subclavian artery going to the right arm, and right common carotid artery going through the neck to the head. Left common carotid artery and left subclavian arteries originate straight from the aorta without brachiocephalic artery. So when aorta goes down, it's called thoracic aorta until it penetrates the diaphragm, and after that it's called abdominal aorta. Down in the pelvic area, abdominal aorta branches into 2 common iliac arteries. What else? The very first small blood vessels originating from aorta would be right and left coronary arteries, and they encircle the heart, giving branches and forming a ring-like structure that provides blood to the heart, muscles, and other heart tissues. Arteries supplying the head and neck. So here we have common carotid artery. Common carotid artery, each of them, left and right, divide into internal iliac artery. It goes to the brain inside of the head and provides brain with blood. And external carotid artery provides blood to superficial structures located outside of the skull, which would be skin and muscles of the face and fat tissues, so everything outside of the skull area. Also, we have vertebral artery. Here it is. It originates from right here, from subclavian artery, and it also gives blood to the brain, goes to the brain area. Subclavian artery itself continues toward the arm as the axillary artery, so practically it just changes its name. But let's continue to the brain arteries. So 2 internal carotid arteries and 2 vertebral arteries, left and right, go to the base of the brain, and that's where they form what is called circle of Willis. Circle of Willis is interconnection of those arteries. So they are connected through the basilar artery, posterior and communicating arteries, left and right, and anterior communicating arteries. Why? That circle of Willis, all those interconnections, provide multiple paths for oxygenated blood to supply the brain if any of those main arteries supplying the brain, either vertebral or internal carotid, are constricted by physical pressure or somehow occluded by disease or interrupted by injury. Brain still will receive blood supply to all its areas. So, arteries of the thoracic region. Aorta goes down, so that is again ascending aorta, aortic arch, descending aorta, and now it's called thoracic aorta, all the way up to the diaphragm. Thoracic aorta gives branches visceral to the organs, that would be lungs, pericardium of the heart, esophagus, and organs of the mediastinum. And it gives parietal branches going along the ribs and giving blood to the walls of the thoracic cavity, including skin, muscles, vertebral column, and the superior surface of the diaphragm. As soon as aorta crosses the diaphragm and goes into the abdominal cavity, the very first large branch would be celiac trunk. The celiac trunk immediately branches into three smaller arteries. Gastric artery going to the stomach, left gastric artery, here it is. Then splenic artery goes to the spleen, and common hepatic artery, here it is, it goes to the right, which gives blood to the liver, some part of the stomach, gallbladder, duodenum, and pancreas. Then we have superior mesenteric artery, providing blood to the small intestine, pancreas, part of it, and majority of the large intestine. Finally, inferior mesenteric artery gives blood to the distal, lower segment of the large intestine, including the rectum. Arteries serving the upper limb. Right subclavian artery going to the arm right now is called axillary artery, and then it again changes its name and it's called brachial artery, which gives several branches. Main of them would be radial artery and ulnar artery. Going along the bones, they come to the palm where they form deep palmar arch and superficial palmar arch, and those two arches give branches which are called digital arteries to the fingers. Aorta, again, when it comes to their pelvic area, branches into two left and right common iliac arteries. Common iliac arteries branch into small branch internal iliac arteries that provides blood to the pelvic organs, and external iliac artery that continues as femoral artery, and femoral arteries gives three main branches: anterior tibial, posterior tibial, it's behind the bone, and fibular, also behind the bone, arteries. Those arteries form arches, giving blood through its branches to their toes. Please stop your video and answer the questions for part 2.4. Now let's talk about the veins. Main veins of the thoracic and abdominal regions drain blood from the area above the diaphragm. So what's above the diaphragm? That's your thoracic cage with all the organs in it, right and left arms, neck and head. So blood from all the veins located in those areas is collected into the superior vena cava, which enters your right atrium in the heart. Main veins of the head and neck. Important structures which are called venal sinuses, like the superior sagittal sinus or inferior or straight sinus, cavernous sinus. All those sinuses, intercranial, they collect blood from the brain, and that blood is carried through the internal jugular vein to the superior vena cava. Subclavian vein, which also goes to the superior vena cava, collects blood from all the veins deep and superficial of the arm. Main of those veins would be basilic vein, brachial, and cephalic veins. Inferior vena cava collects blood from all the structures of the body under the diaphragm, which will be abdominopelvic cavity and legs. So right and left leg, also pelvic cavity with all the genitalia and organs of abdominal cavity. So the main vein that collects blood from the legs would be femoral vein. And also pay attention to the great saphenous vein. Here it is. It's the longest blood vessel of the body. Blood from them goes to common iliac vein, which enters into inferior vena cava. Hepatic portal system is a different structure. It's a circulation system which exists between the liver and organs of abdominal cavity. Digestion and absorption of foods, mostly absorption happens in the small intestine. All those nutrients that are absorbed into the blood, they do not go straight to their circulation. They first, through the system of veins, are collected into the hepatic portal vein and go to the liver. Liver also receives blood from normal systemic circulation through hepatic artery and releases blood into the hepatic vein. But hepatic portal system collects nutrients absorbed in the digestive system, carries them to the liver, because liver will decide what to do with them next. Some of them will stay in the liver for processing, others will be released to the blood. Fetal circulation is very different from a baby who is already born, and there are several differences. We will be talking about them in details when we go through the chapter on human development. Right now you need to know three main differences. The foramen ovale exists between their right and left atria. They are connected in a fetus. Then, ductus arteriosus connects pulmonary trunk to aorta. And finally, ductus venosus, here it is, connects inferior vena cava to the umbilical vein that goes into umbilical cord. All those structures disappear after the birth. Please remember to answer the questions for part 2.5.